Today we are about to discuss about the environment and human health, the climatic changes and human health, the role of information technology in prevention and care during environmental health hazards. If I talk about one individual, the individual is born with a genetic constitution in which the parents have given the genes, and these genes are showing its effects through the body contour, the faces, the look, the nature and all the attributes that the child has. But however, these all changes which the parents have given again will have an effect of the environment as soon as the child is born out, and these environmental effects make the environmental constitution of this person and make this as an individual. If the effects are very good and the environment is well tuning, in that condition there is an overall growth of this individual. But if certain bad effects do occur, in that condition there is a maladjustment and problems in life. The problems in life here to be addressed are about the health only, but however the solutions will be similar. The solutions are either the person changes the environment, that means if a person is working in a cement industry and is having allergy with the cement or some disease pattern, occupational disease, in that condition the person will have to change the occupation and the environment is changed, okay, the person gets well. This person may change the environment in the sense that quit from the environment, run away. That means a person living in Indore, say for example, is not getting tuned with the environment, may go and live at Mumbai where there are lesser extremes of weather. And similarly, the person may acquire safety measures. That means as we wear woolen clothes in winter and we avoid woolen clothes in summer. Similarly, the person as a third measure may go for the adaptation. It is said that when some problem is inevitable, it is better to relax and enjoy it. Coming to health and environment, we have two types of environment. Usually for every individual, it is micro environment in which the person lives. That means his eating habits, his sleeping habits, his other habits, and that those of the addiction that we want to address. That means maybe alcohol, maybe tobacco, maybe other things that the person is used to, and the person may quit them and get healthy. Then the macro environment, this is the holistic community picture when whole of the community is getting affected in certain cases. Say for example, there is an epidemic of the disease. Epidemic is a broad scale occurrence of the disease. Endemic is a small scale occurrence of the disease in a limited population pattern, and sporadic is a cluster here and a cluster there, but these all disease patterns do occur because of the change or variation in the macro environment of the individuals. Environmental hazards may occur, which are usually, we say that it is quarter of the total burden of the disease worldwide and 1/3 of the disease burden among the children worldwide. They appeal, and they are particularly through diarrhea, lower respiratory tract infections, various forms of unintentional injuries. Unintentional injuries do not only mean roadside accidents, but they may even be, say for example, radiation injuries, say for example, injuries through the smoke, say for example, the injuries that occur through the vectors, maybe rodents, maybe mosquitoes and others, and malaria is the dreaded one of them in whole of the world. The disease burden is much higher in developing world is a well known fact, but however in the developed countries, the non-communicable diseases like cancers, like cardiovascular diseases, like diabetes, the disease burden is more there. We need well targeted interventions, and that is the only way that we can prevent the 30 million deaths which are occurring every year in the world. The environmental health addresses two types of environment, that is the natural environment and the built environment. Particularly when we talk about the air quality, it includes both the indoor pollution and the outdoor pollution. That means within the home, when the pollution occurs, this is indoor air pollution. This may occur through the smoke that is produced by the hearth in our own household, and most of the women and children are more susceptible to it because they have to sustain more time with this hearth. Passive smoking is not to be forgotten, however, because those smoke tobacco, they think I am polluting myself only, but no, this person is damaging the health of all the household people that are residing there, particularly in the overcrowded houses and certain other places. Body art safety like tattooing, body piercing, permanent cosmetics, they may lead to a chemical injury that is to be addressed. Climatic change, we know that wherever the climate is different, and as soon as you enter a different climate, say for example, a dog from Switzerland may not survive on the equatorial regions. So, we can understand how the climatic change affects the life, and that particularly the human beings which are affected by the climate. The disaster preparedness, we know that we are burning away the fossil fuels, we are depleting the earth of the ground level water and certain other things, and in that conditions we are prone to disasters. Are we prepared for the disasters? Can we respond whenever the disaster occurs? Food safety is again one thing to be addressed. Safe food through safe agriculture, safe transportation, safe processing of food, and wholesale and retail distribution, so that at least every person gets what the person needs. That means the underprivileged sector also is not undernourished. The hazardous materials management is to be taken care of, where the hazardous wastes are generated, particularly say in the hospitals, in the pharmaceutical industries and other places. Housing, wherever the substandard housing is there, say for example in the jails, prisons, or in the unprivileged section of the society where many people have to reside within a single room or 2 rooms or so. In that condition, naturally the overcrowding leads to communicable diseases which is spread from one person to other. Childhood lead poisoning is also a global issue, but however not to be addressed here. Land use planning and smart growth is maybe one of the ways through which we can get through. Liquid waste disposal. If every industry of ours, if every hospital of ours has an effluent treatment plant, recycling of water, the reuse of water, and avoiding the wastage, along with the infections that prevail, the pollution of the water that prevails, this can be reduced to minimal. We can have septic tanks, chemical toilets, so that the water pollution minimizes away. Medical waste management, nowadays every country is taking care of, but the Pollution Control Board yet have to take strict measures. Noise pollution control, yet we have certain places, though awareness is spreading in the urban sector, rural sector is not having that much of noise pollution, but however we know that even there are malls, there are places, there are public places where noise is to a very great extent out of the audible ranges. Occupational health in the industries and industrial hygiene is very important. Radiological health when we are spreading radiation and ionizing radiation. Similarly, safe drinking water and arrangement of safe drinking water and solid waste management is something to be addressed upon. Now, if I talk about environment in general, what human being is doing to the environment, I start from underground level. We are depleting the underground water. We are depleting depleting our earth out of the minerals. We are depleting the earth out of the fossil fuels. Ultimately, what we are leading to: tsunamis, cyclones, hurricanes, and maybe earthquakes, drought situation, and other such calamities which may occur over the human beings, and ultimately the human health is at stake. Are we prepared for these disasters? Similarly, we are felling the trees away, creating the jungles of architecture. Ultimately, we are warming the globe, and this global warming has addressed through the glaciers that are getting melted out, and the water level in the rivers is rising. What is it ultimately going to address? We are felling out the trees, and the depletion of the ozone layer. Ultimately, ultraviolet radiations are entering in, and our skin is getting tanned away. Then okay, ultraviolet rays are essential. Say for example, it produces vitamin D3 in body, and without ultraviolet we cannot sustain. That is a different issue. But however, that much of ultraviolet radiation which is generating cancers is not good. We need vector control, including the control of mosquitoes, rodents, flies, cockroaches which generate the pathogens. We have to control the vectors also. The one thing that is usually not being addressed, or rather it is two. One is ionizing radiation. Whatever was buried into the earth by the nature, the radioactive chemicals, we have brought them out for the sake of human energy development and the energy that we need to sustain. For this, we are using the radioactive chemicals, maybe for the medicinal use, maybe for other uses, but however, we are producing radiation, and this radiation is getting hazardous for very many people. Then again the electromagnetic waves. Everybody is carrying a mobile phone in his pocket. Electromagnetic waves have to be radiated. We have several gadgets and the technology is advancing, what not. What we are going to witness in next world, we do not know. Now we will discuss the effects of climate on health. When the change of climate is there and we see that there are extreme temperatures, we have been knowing about the deaths due to extreme temperatures, extreme cold, extreme hot, and these temperatures again create a very many health problems like waterborne diseases in summer conditions and certain respiratory and viral conditions in the winter conditions. And the extremes of weather events, say for example it is a damp climate continuing say for 2-3 months. In that condition, this damp climate usually leads to viral infections and epidemics do spread. And then the health effects of more variable precipitation patterns that precipitate out many of the disease patterns, the rising sea levels, the retracting glaciers, the food insecurity. Rather, food insecurity is one thing to be explained or clarified, that we have protein energy malnutrition as a worldwide problem, particularly in the developing and underdeveloped countries where the protein and energy is less, and in that condition due to undernutrition many children under 5s used to die. There is a intrauterine growth retardation, that is the fetus within the womb does not develop properly because of protein energy malnutrition of the mother. And in all these conditions, though if we address the unprivileged population of the world, we can say it is undernutrition, the people are not getting enough food to eat. But when it is well-versed people, they are having enough, they know, but they are so choosy to choose the fast foods, not the nutritious diet. The next thing to be addressed is vector-borne diseases. We know how much disease pattern the plague and other diseases are being spread by the rodents. How much of that is being spread by the mosquitoes. Mosquitoes spread malaria, filaria, dengue and other such diseases. The other health effects may be because of the cockroaches, maybe because of the flies, that means the Vibrio cholerae spreads through the flies. Increasing global temperatures are leading to global warming, and these global warming effects are leading to desertation of the world, and in that condition what will happen everybody can understand. Again we have to address the ozone depletion because of the climatic effects, greenhouse warming and the ultraviolet radiation that is damaging the people. What responses can we generate? One thing is, as we initially said, adaptation, but adaptation is something like a temporary measure that we can adapt to a situation, but when we say it is mitigation, mitigation is a long term process, years long to go naturally for the sake of protection, but this protection is a sustained protection. If we plant 1,000 trees today in a particular environment, in that condition we are sure that the environment is going, the air is going to be underpolluted. This air will be free and fresh at a particular level of time, say 10 years later, say 20 years later. But however, we are doing something, and this mitigation will lead to less of the soil erosion, less of the desertation, less of the global warming, more of the rains, less of the drought, less of the other calamities that may occur. The main determinants of the community's adaptive capacity are economic wealth, technology, information and skills, infrastructure, institutions and equity. If they are all used, if they are all collaboratively used for the sake of mitigation, they will help a lot. Public health in India has garnered worldwide attention and as a result has prompted massive public health initiatives and knowledge networks throughout the India in past 10 years. If I say knowledge networks, that does mean we are implementing information and technology, and the role of IT comes forth. Talking about the role of IT, the first and foremost thing to address is remote sensing. Through the remote sensing, through our satellite, we are having every information about the weather, say for tomorrow, say for a month later, say for a year later. And if we can understand through the remote sensing what all is going to happen in the weather and the climate, in that condition we can take protective measures, perfect protective measures, so that most of my community is protected. The database, a vast quantum of information that is generated through the database, it is going to help the doctors to monitor the patients, to monitor the conditions, to monitor the awareness programs and other things, and the patients can seek help of a super specialist doctor placed at a far off distance through telemedicine. Similarly, our hospitals are taking expert opinion, first expert opinion or second expert opinion, even through video conferencing technique. Mapping is one of the tools through which the environmental health mapping is being done through Geographic Information System GIS. This is the Division of Specialized Information Service of the United States National Library of Medicine, through which the data is generated, and this gives a very good mapping and helps to release the burden of the disease. As we earlier addressed the indoor air pollution, and through the indoor air pollution we have the respiratory disease risk and other risks. These risks can be minimized, and our good World Health Organization is having a program on it, a WHO's program on indoor air pollution, which focuses on research and evaluation, capacity building and evidence for policy makers. So, when we are going to generate some evidence, naturally IT is being used, information technology is being used, and we are doing the research and evaluation. Capacity building naturally is a human resource function where we train our manpower to build their capacity and be able. Talking about outdoor air pollution, naturally we are using combustion devices, motor vehicles, industrial facilities, forest fires and certain other things through which the pollutants like carbon monoxide, ozone, nitrous oxide, sulfur dioxide and certain other pollutants, they are polluting the air. The WHO is running a program about urban outdoor air pollution database, again enabling IT. International program on the chemical safety is being run. The WHO is working to establish the scientific basis for sound management of chemicals and to strengthen the national capabilities and capacities for chemical safety. The Global Plan of Action for Children's Health and Environment, the third WHO International Conference on Children's Health and the Environment in Busan, Republic of Korea, June 2009 had addressed a draft global plan of action which was designed to give us the Millennium Development Goals, which are related to reducing the infant mortality, that is MDG 4, and ensuring the environmental sustainability, that is MDG, Millennium Development Goals 7 program. It was recognized that successful implementation of this global plan for action requires strong partnerships and close networking, and naturally the collaboration of WHO, UNICEF, UNEP and other national and other regional organizations is highly required. They should acquire collaborative activities for environmental protection, climatic change adaptation, primary health care, specialized hospital based health care, emergency response, disaster risk reduction, school activities, housing initiatives and many other activities. The Global Plan for Children's Environmental Health 2010 till 15 addresses the acute respiratory infections. Usually 1.6 million children under the age of 5 are killed because of acute respiratory infections. The diarrheal diseases, in which 1.5 million children every year are getting killed, and nearly 1 million children under the age of 5, they die because of malaria. So, these three diseases are to be addressed highly. WHO program usually focuses on national profiles, CEH indicators, which again want IT in it, capacity building, that is a HRD function, guidelines, good practices and tools, and research. The next attribute to be addressed is electromagnetic fields. All the populations are now exposed to varying degrees of electromagnetic fields because the technology is advancing. As part of its charter to protect the public health and in response to public concern, the World Health Organization WHO has established international standards of EMF project in 1996 to assess the scientific evidence of possible health effects of EMF in the frequency range of 0 to 300 gigahertz. The EMF project is open to broad participation. The health impact assessment is being done, and this one thing is to be addressed is the transport. Transport is a major factor in traffic injuries, air pollution and noise, and in agriculture the fertilizers and pesticides that we are using that are proving hazardous. The health impact assessment is a means of assessing the health impacts of policies, plans and projects in diverse economic sectors using quantitative, qualitative and participatory techniques. Housing and health. The international guidance on healthy housing should be developed to help prevent a wide range of diseases and unintentional injuries that can be effectively addressed through better housing. One of the unintentional injury again I shall address is passive smoking. The World Health Organization WHO program focuses on experts' call for international guidelines. Health in the green economy is one more concern. Many strategies to reduce climatic change have large immediate health benefits. Others may pose health risks or trade-offs. Examined systematically, a powerful new dimension of measures to address climatic change emerges. Health and Environmental Linkages Initiative HELI is a global effort by WHO and UNEP to support the action by developing countries and their policy makers on environmental threats to health. It encourages the countries to address health and environmental linkages as an integral to economic development. It supports the valuation of ecosystem services and the climatic regulation to prevent replenishment of air, water, food, energy sources and generally healthy living and working conditions. The activities of HELI include country level pilot projects and promoting better access to knowledge and tools, again through IT. The healthy settings which are developed usually by the World Bank, the health is created and lived by people within the settings of their everyday life where they learn, work, play and love. It is a multidisciplinary method of using the healthy settings, and the holistic system approach is to be used. The healthy settings, the key principles include community participation, partnership, empowerment and equity. The Healthy Cities program is also being run by WHO since 1986, and the healthy cities, which usually not only the building but other things which are required by the environment are being created in the city. Addressing the ionizing radiation that we were talking about, the WHO's ionizing radiation program is running. The radiation and environmental health program within the WHO's sustainable development and healthy environment clusters, it evaluates the health risks and public health issues. It looks for the solutions out, and for the promotion it promotes research also. To promote the improvement of working conditions for the workers in the industries, it also acts there. WHO has developed a global work plan in collaboration with WHO network of collaborating centers based on objectives of GPA for 2009 till 2012. The work plan organizes the activities of collaborating centers into 14 priority areas. Quantifying the environmental health impacts. When I say quantification, that does mean how much is the environment affecting and how much is the person willing to survive in a good condition. There is one abbreviation DALY, DALY. When I say DALY, it is disability adjusted life years. This does mean that when, say for example, a person of 20 years has got a fractured foot or an amputated foot, in that condition either this person may opt to survive without a leg and be not that much productive as this person can be, or the other way, this person can have a prosthesis of the limb, a different limb say made of prosthetic material and applied over the body, and then this person is more productive and working. This person, if this person survives say for 60 to 80 years more, this 20 years old guy, in that condition the disability adjusted life years without a prosthesis that this person leads is almost 60 to 80 years. So this adjustment of the life years is very important, which is to be reduced all over the globe, and it is to be addressed very well. Additional information we have for the rational development of the policies by the health sector, the effectiveness and cost effectiveness of interventions, the availability of resources and the type of the policy environment. This all again is generated through information and technology. The ultraviolet radiation that we initially addressed to for skin cancers and the eye problems, this is being addressed to by WHO, and WHO is doing for it through the InterSun program. For the water, sanitation and health, which is very important for the sake of health, WHO on the aspects of water, sanitation and hygiene, where the health burden is high, where interventions could make a major difference, and where the present state of knowledge is poor, our work is divided into six core activities. One is drinking water quality management. Second is water supply and sanitation monitoring. Third is cholera surveillance and prevention, because cholera is the dreaded disease, and the sanitation in different settings. Then water resource management, miscellaneous activities. However, we have protocol for assessing community excellence in environmental health. It is named as PACE-EH, PACE-EH, and it is NACHO based project which is being run through the WHO, and environmental public health performance standards that are being evaluated through the role of information and technology. Finally, I would like to conclude that the environment has a vast effect over human health that has been addressed through not only the water, not only through the air, not only through the light. Light pollution again is one of the big things to be addressed nowadays, and not only through the sound pollution, not only through the felling of the trees, not only through the depletion of the earth through the resources, but however we are getting affected through the ionizing radiation and electromagnetic fields, which are all to be addressed, and people are to be made aware, because and when we want to make them aware, naturally information technology is going to give us a wide difference, that this information technology can be propagated. Even in India, the Gram Panchayats also have an access to IT. So this access to IT and access to internet has helped a lot, and this will continue to be, and I wish the health of India will be blossoming, and every person will be productive in future.